During this time of the year, there is a focus on suicide prevention as the world, including Belize, heightens the awareness on this issue. It is also during this time that the country records an increase in the number of deaths by suicide.
World Suicide Prevention Day is actually September 10th. So, countries around the globe is doing many different activities to build more awareness on how we can prevent suicide. But the mental health program at the Ministry of Health and Wellness, that doesn't stop us. We continue to push our agenda. We need to continue to educate the public on how we can prevent suicide.
According to data, 31 deaths by suicide were recorded in 2021. It's the highest number in recent years. Of those cases, only 6 were women. 25 were men who chose a more lethal method like a gun to the head rather than ingesting pills or poison. Women, however, are making more attempts.
There's different mental health conditions that could impact a person to the point that they have suicidal thoughts. The most common one would be major depression disorder. Once somebody has depression, a severe depression, it's highly likely they will have suicidal thoughts. And once one person has attempted once, their risk is even greater for that person. So we have to continue working with that person to prevent another attempt or to prevent the death.
And according to psychologist Juliet Simmons, there are conditions such as schizophrenia, bipolar, and some personality disorders as well. So mental health illness is a big factor in suicide gestures. News 5 sat down with mental health counselor and managing director Krista Courtney of Monarch Counseling and Consulting. She speaks about some of the signs to look out for.
One is isolation is a main one. Now you'll find some people, you feel like they're isolating, maybe they're just an introvert, but it's always okay to ask. If you notice somebody pulling away, not participating, especially if they used to, and now it's a change in behavior or a shift, those are things we want to pay attention to. If someone used to be more shy and now they're taking more risky behaviors or really acting out, any major shift is something that we want to pay attention to. Not all mental health conditions will lead to having suicidal thoughts or ideations or creating a plan or even attempting. But you do find that often when people don't get the help that they need, or they start to feel very alone and isolated, or they're really fighting to try and deal with their issues, but they're not really making progress, they get really tired. And that often leads to sometimes the suicidal attempts or thoughts. And expressing that to someone, you can be really afraid that they're not going to know how to react or respond. And so they tend not to. So if we make it more safe for people to say, I'm not okay.
There are school counselors in almost all high schools across the country, and they're trained in how to recognize the signs for suicide, how to start the conversation, and when to make the referrals to clinics and other professionals. Courtney and Simmons say that there are services available in the private and public sector for persons to get help.
mindhealthconnect.com is the website that we put together. We're always updating it as we get more information or there are more providers. So we try to keep information on private clinicians who are available that you can access and what their fees are, who accepts insurance, etc. And also public resources, and especially as the ministry works to expand them to make them a lot more robust in the districts, not just in the city. Those things will also be obviously updated on the site often.
We're proud of what we've done, but there's still a long way to go. So yes, there's more service today than there were 15 or 20 years ago.
On Saturday, the public is asked to remember those who have been lost to suicide and those still breathing by lighting a candle at 8 p.m. Duane Moody for News 5.